And I think we've got one more prepared question. Are you up for it, Tim?
I'm ready.
All right. Tim is our cleanup hitter here. Okay, whose phone is that? Martin? There you go. All right, here's the tough one. Can we really afford to pay for health reform in this difficult economic climate?
Well, the answer is not only can we, but it's even more important that we do so. The question that you'll hear a lot is this going to add to the deficit? And you heard from President Obama last night that he will not sign a health care bill that adds one dime to the deficit. Now, a lot of folks who've been going to town halls have been screaming that, of course, it's all going to be funded by the deficit and bankrupt, blah, blah, blah. And I can understand where they're coming from, because we've just gone through 8 years where that's how we paid for most things that we wanted to do. The Bush tax cuts, not paid for through the deficit. The Iraq War, all on the deficit. Medicare Part D, all on the deficit. So I can understand where they're coming from, but again, that was the other guy. President Obama has said that health care reform must be paid for. The members of Congress have said health care reform must be paid for. It's not that we don't know how to do it. There is a superabundance of ideas of ways to trim waste in Medicare, in Medicaid, the treatments that don't lead to better health outcomes, tests that we don't need to take because they're duplicate, cutting down on some of the more expensive phenomena in our hospitals that will actually improve quality, like hospital readmissions, which are very costly and very easy to prevent. So we can find the money. We can also find some share of new revenue. That's not the issue. And if it doesn't add to the deficit, I'm going to borrow a metaphor from the blogger Ezra Klein here, the $20 that's sitting on my bureau, it makes no difference whatsoever to my credit card if I spend it on a movie or if I spend it on pizza. If you can pay for it, you can afford it. Now the question is, should we commit this amount of money to pay for it? And the answer is absolutely, because the option of not paying for health care increases doesn't exist. If we do absolutely nothing, if this health care reform fails, 8 to 9% increase next year, 8 to 9% increase the following year. That's been true since the 1970s. Healthcare costs will only continue to rise. It's 16% of our gross domestic product right now. If we do nothing by the end of a putative second term for President Obama, it'll be 20% of our GDP. No other country, no other industrialized country in the world is it more than 10% of their GDP. So we need to tackle this head on. The only way to tackle our long-term fiscal picture for the federal government is to reform health care. The rising cost of Medicare and Medicaid has major impacts for the deficit, for the debt, so on and so forth. Now, why is it more important now than ever in this economic crisis? Well, frankly, because the services that we as taxpayers pay for are more in use because there are more people who are uninsured because they lost their job when they lost their benefits. There are more companies that are saying, these are tough economic times, we have to cut the benefits, and even if we're keeping the employees. Those people will still need care. They will still show up in the emergency room when they need to be treated. There will be more and more people who are on Medicaid, which is paid for by federal dollars and state dollars. There will be more and more people who get what's called uncompensated care, which is paid for out of tax dollars and higher premiums for the rest of us. The need to reform this is actually greater in tougher economic times. So if you're not compelled by this notion of social justice, if you're not compelled by the moral imperative, realize that there is a financial imperative if we somehow fail to reform healthcare reform this year.
Thank you. Great answer.